and welcome again to another episode of the TMCSL Health Hour. This is me again, Dr. Claudine Gosoko, and for today, we have a very special guest who will be talking about chronic pain. So we have here a specialist for physical medicine and rehabilitation. He's actually invited regularly to teach in the American Academy for Physical Medicine and Rehabilitation since 2015. So without further ado, let us all welcome Dr. Franklin Domingo. Hi, Dr. Domingo. Hi, Dr. Franklin.
Hello, Dr. Claude. So good to see you.
Yes, so good to see you, and welcome again to our session for today, the TMCSL Health Hour. We're so honored to have you here. It's a bit common these days that patients experience different kinds of pain, right? I'm sure you see in the clinic a lot of patients experiencing different kinds of pain.
You are right. Day in, day out. That's what we see
Yes.
at clinics downstairs.
Yes. So maybe just to give everybody an idea, some people experience pain which is probably for a long time already, or what we call chronic pain, right? So, Doc, how can you describe chronic pain, or what is it really? Is it a condition, or is it a symptom, or how do we say a person has chronic pain?
Very good question. Chronic pain is actually a condition. It's a condition that is indicative of an underlying disease process. So it's something on the surface, which means that we have to dig deeper and to look at what the cause of the chronic pain really is. There are many kinds of pain, and one of them is nociceptive pain. Nociceptive pain meaning an injury into one of the organs, one of the tissues, one of our muscles, our bones, which we experience. That's nociceptive pain. But the other kind of pain, which is more severe, more chronic, could be neuropathic pain. And neuropathic pain, as the word implies, involves the nerves. And when the nerves are involved, the pain cycle just keeps on going and going from the area that is affected to the limbic system, to that part of the brain which also controls our sleep and also controls our emotions. Kaya sometimes some of these patients, if they have severe pain, their sleep is affected, they get to be a bit more grumpy. Things that they didn't complain about before are actually being noticed already. So that's what we see when we have patients with chronic pain.
Right. So you mentioned, Doc, that chronic pain is actually, there's a lot of contributory factors to it. So maybe, Doc, can you give us examples of what are the risk factors of common risk factors for patients experiencing chronic pain?
Some of the most common chronic pain conditions that I can think of right now are the arthritic pains, okay?
Yes, Doc.
Pain in the knees, pain in the shoulders, pain in the back, okay, which can sometimes be because of problems in the facet joints, or sometimes pain in the back itself brought about by a problem with the disc. And when these patients experience pain, what usually happens is that the pain initially happens for a short period of time, but then if the pain is not given the right solution or is not diagnosed correctly, it becomes more chronic. And one of the risk factors for this would be the patients repetitively doing things. People who repetitively climb stairs, people who repetitively do tasks like staying in front of the computer for too long, a lack of exercise, poor nutrition, and of course, poor sleep. And it all goes back to that, actually. And the three things which I usually ask my patients to take care of to make sure that the pain has a lower chance of becoming chronic are, as I mentioned earlier, sleep, okay, nutrition, and you know what? The first episode featuring Dr. Manlapas actually had a good talk about nutrition. So nutrition is very important, and of course, exercise. And that's where we come in. We can teach the patients to strengthen the muscles that surround the joints that are hurting, okay? And when we strengthen these muscles, we improve the stability of these muscles. When we improve the stability, we decrease the chances of the pain not only recurring, but more so the pain not getting to be more severe. So again, the key word here is control. So what we can do with patients who have chronic pain is we can control the pain.
I think it's a common myth now with people that when they're experiencing pain, they will not do exercise, right? Because some people think na, because ang sakit, parang ayokong galawin yung tuhod ko, ayokong mag-exercise kasi ang sakit. Is it the right attitude towards it, or how do we address this kind of patients?
Just take into particular low back pain. When low back pain patients do not move, they stay in bed when their back really hurts. Research shows that the chances of the pain becoming more chronic and more severe sharply increase. So what we usually recommend for patients with low back pain is to, as much as they can, to get up out of bed. If they have to stay in bed one day, that's it, okay? But after that, they have to get up, get moving, because what happens if they don't move is that the muscles that are supposed to support the back or are supposed to support, let's say, the knee or other parts of our body that are affected with pain, they actually atrophy. They get weaker. And when these muscles get weaker, the support that these muscles provide to these vital structures actually diminishes, and it can diminish by as much as 1% per day in some patients. So if you can just imagine, if a patient does not move for like 10 days, diba? So that's 10% of the strength of that muscle, which is actually just gone. But we can recover that through the right diet or nutrition, sleep, and of course through correct exercise. That's why it's important to see us doctors, physical medicine and rehabilitation specialists, because we can make a tailor-made program that will address the specific individual. So it's a very, very individualized approach, a multimodal approach, multidisciplinary approach that not only involves me as a doctor. We will be involving physical therapists, sometimes occupational therapists, and a whole lot of other doctors in the team who can actually address the patient based on the specific needs that they have.
What will be the role of the physical therapist or the other the therapist in terms of them controlling the pain and being helping them to at least make sure that they still do their activities? Or how are they supposed to know that they need these kinds of therapies, Doc?
Mm-hmm. So if the pain has been there for quite some time, like maybe 3 or 4 or 5 days, maybe even a week or sometimes even longer, and the pain is still there, so kung nandun pa rin yung sakit, kailangan nang pumunta sa doktor. Part of aging, sometimes people feel that as they grow old, it's okay for them to experience pain. It's actually not okay to experience pain. It's something we can avoid. And we can come in to help, because kung hindi tayo gagalaw na kaagad, lalala lalo yung problema.
Yeah.
So pag mas malala na yung problema, mas mahirap ng pagalingin. So that's what the problem is actually. So the sooner we treat these patients, the faster we see them, okay? The earlier we can institute alongside with the exercises that are well suited for these patients. So doing the right thing at the right time counts.
Since you mentioned, Doc, na pain is actually very controllable, especially at early stage, what are the different things that we can do to prevent, at least, or if there's any, to prevent the common pains that people experience, for example, low back pain, or knee pains, or arthritis, hip pains, or is there anything that they can do aside from the 3 things that you mentioned earlier, sleep, nutrition, and exercise? Anything else, Doc, that we can advise them?
Yes, for low back pain patients, let's be more specific. So we try to tell our patients not to lift heavy objects, lalo na kung hindi na bata, okay? Kasi wala pang gamot na pampabata, di ba? And we need to tell our elderly people na, if going up and down the stairs repeatedly hurts their knees, so they should stop doing that. So you should just do everything you need to do upstairs in your room, go down once, tapos do everything that you need na, and then aakyat na lang po sila sa kwarto nila pag matutulog na. So avoid climbing stairs. Losing weight, very, very important, alongside with the nutrition, right? But you need to do it right. If people try to do these things on their own, trying to attempt to improve their amount of exercise, they can get injuries, especially if they're not well prepared for it yet. Pag nagka-injury, ayaw na mag-exercise. We're here to guide our patients. We're here to make sure that they become successful not only in exercise and weight management and sleep, but in all the things that they need to do so that they can help other people around them, because that's what we're here for, right?
So if you have these kinds of pains that you've been probably just taking any pain medications at home, then they're not being controlled, then I think that's a time that we need to see physical medicine and rehab specialist or your doctor so that they can actually guide you to the proper management of that kind of pain. Maybe for the last question, Doc, where can we find you if we have our guests here or our viewers who want to consult you, Doc?
And I'm at room 215, and we also have therapists at the Physical Medicine and Rehabilitation Center at Basement 2.
Yes, Doc. Okay, so thank you, Doc, so much for your time today.
It's been a pleasure.
Yes, Doc, and thank you everyone for staying with us here today. So if you like this video, just click the like button, and of course, don't forget to subscribe our channel for more videos in the future. So thank you again, Dr. Franklin Domingo. Yay! Thank you, Doc, and thank you, everyone.